engage in problem solving, identify and promote a culture of safety, and incorporate evidence-based practices. These are key areas in the value of improve, which have been embraced by our next award-winning team. Bellin Health recognizes the Feeding Tube Redesign team for this year's Values in Practice Team Award winner for Improve. Across the nation, there's a 20% complication rate among patients who need or use feeding tubes, which are also known as PEGs. But that percentage wasn't acceptable to those caring for feeding tube patients at Bellin Health.
The patients that generally get feeding tubes will be head and neck cancer patients, and then also stroke patients will get them as well. So those people that really can't swallow. So these patients often would end up with anything from skin irritation around their feeding tube, or sometimes that feeding tube, if the feeding tube migrated into the colon farther, it could cause some more damage. So if there's not regular follow-up with these patients, they can lose weight, they're just malnourished.
We had a few feeding tube patients who either had complications or undesirable outcomes that caused the system to step back a moment and say, hey, can we do this better?
Our chief nursing officer actually gathered a group of people. There's physicians and staff from the cancer center, the GI lab, nurses throughout the system. We have a surgeon on the team. And then what we actually felt was very beneficial is we have a patient on our team.
From that point forward, we looked around the nation, seeing what other places were doing. We combined what we liked about their programs, what we didn't like about their programs, and looked at what would work best for our patients here at Bellin Hospital. This was a project that didn't involve one system, one level, a couple providers. It involved so many systems, so many different disciplines, so many different avenues, from nursing to implementation of new computer orderized entries.
And I have to put a shout out to Parnell Pierce, who, when technology roadblocks were thrown up in front of us time and again, he would always pose the question, what is the right thing to do for the patient?
We put this team together and really did some evidence-based research and came up with the nutritional support team that we have today.
The nutrition support team is a one-stop shop for people who have a tube placed. And what it is it's a resource to send the patients to help them know that they've got a resource to go to with any tube-related questions, from how do I get my tube feeds? I've changed my address, how do they get delivered? I'm having troubles with this formula of tube feeds, let's see how we can adjust it. Oh, this part of my tube cracked, what do I do? All these questions, patients sometimes didn't know where to go to with those questions.
We're really trying to prevent little issues that they may have early on from becoming big issues that lead to ED visits and unnecessary hospitalizations.
Since we put this team together and came up with a nutritional support team, we have actually had really good results with this as far as keeping the patients out of the emergency room.
I would love to thank Laura Heap. Without her and her driving force, we just wouldn't have gotten as far as we have.
I could be here like the Oscars, going through the list of everything that was done to make this project happen. If you read through the list of the people involved in this team, I think it's upwards of 50 people, which is really what it took to make it happen. And so thanks to everybody.